Hospice care is designed to be the right approach at the right time when the patient's ready for it. And hospice care focuses on aggressive symptom management. And patients frequently ask the question, when is the right time for hospice? How will I know when it's the right time to think about hospice? What I like to do is I try to talk to families about how inexact prognosis is. When doctors talk to patients about life expectancy, they usually talk about how many years you have to live or how many months you have to live. When we go below months and when a doctor says, I think we only have weeks, it's definitely time to be thinking about hospice care. What are the things that patients and families can look for that will tell them that maybe it's time to begin thinking about hospice? We use a scale, which is a very simple way that any layperson can take a look at a medical situation and get a general idea where their loved one's at. It's called the Palliative Performance Scale, and a normal person starts at 100%. At 100%, you're able to do any activity that you would want to do. You could climb up on the house and hang up the Christmas tree lights. The scale goes down in increments of 10%, down to 10%. A person at 10% is in bed, they can't get up, they can't walk, and they can't talk. The person at 10% has days to live. The person at 100% probably has years to live. So the most reliable general indicator that families can look for is as that function declines, and typically when we reach the point at about 30 or 40%, and here's what that person looks like. If they can walk, it's with great difficulty. They cannot get up out of bed on their own and safely move around the house. That's a description of someone who's at a palliative performance scale between 30 and 40%. And when a disease process, whether it's cancer, heart disease, or lung disease, reaches this point, it's really time to start thinking about hospice care, because you know you started at 100, you're at 30, and 10%, you have days to live.